Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Sri Bhargava Natish. He did his graduation from prestigious, one of the oldest Mysore Medical College, and did his post-graduation from Minto Regional Hospital, Bengaluru, and also from CMC Vellore. He did his fellowship in oncology from New York and did the fellowship in retina from Shankara Netralaya. Now he is the director of Netra Eye Hospital, Bengaluru, and also a CMO of the Drishti Eye Hospital, and he's a senior visiting consultant of Solanki Eye Hospital and Baptist Hospital also. So welcome, sir.
Thank you, madam. Thanks for the invitation and the
Yeah,
opportunity.
it's a pleasure to have you on our show, sir. You are expert in the retina treatment as a retina surgeon. But first, I would like you to tell our viewers what is this retina, where it is, and what is its function.
Yeah. So retina can be compared to a film in a camera. So we have lens in the front and in the back we have a film, something similar. So when we put a torch, probably we see the eyelashes and the white of the eye and the black of the eye, what we call as cornea. But retina is little deeper in the layers of the eye, which is in the back portion of the eye, and we don't generally get to see it. Only
Only the eye specialist can see it through their fundoscopy.
To the set of lenses and
Yes.
examination.
Yes.
So retina is a light sensitive layer which is made up of lot of neural network and also lot of blood vessels. So what is the function of the retina? Retina basically captures light, converts into electrical signals, and through the optic nerve basically sends the signals to the occipital lobe of the brain.
Okay, that is at the back of the
At the back
thing.
of the
Ultimately, the brain decides what we are seeing, but then it is the eye, and this retina is very important. Yes.
Correct. So brain gives a meaning to what eyes make us see. Basically.
Yes, sir. Yes. So now you said that retina is very important, and to see whatever we are seeing, to visualize it is important. Now, what are the things that can damage the retina?
Yes, madam. So retina, as I said, is has lot of a network of blood vessels and nerves. So whatever the diseases that can affect the blood vessels in the body can also damage the retinal blood vessels and in turn retina. So we have many diseases. The commonest being diabetes, systemic hypertension, high cholesterol, smoking. All these diseases affect the blood vessels.
Yes.
We have other diseases which are inheritable genetic diseases, and very rarely we also see cancers in the eye.
Okay. So here, you said blood vessels. So sometimes the diabetic retinopathy, to occur, are the nerves also damaged? Because the diabetic, what to say, the neuropathy is there in the body. So can the nerves also be affected in the retina?
Yes, ma'am, definitely. So retina basically gets affected in the form of occlusion of the small blood vessels. We call it as microcapillaries. So you are a famous cardiac surgeon. In the cardia, probably it's the big vessels, macro vessels that will get blocked. And in the kidneys and the eye, it's the microcapillaries that will initially get blocked in the. And when this is happening, the patient is unaware. He is asymptomatic, no
because
problem
it
at
is
all.
a very small area is affected, so they don't.
They
Whereas
don't.
in the case of heart, when the major vessel is blocked, they come with a heart attack. But here, tiny vessels are blocked, so they don't realize it.
They don't realize that it happens over time slowly.
Yes.
And so till they reach such a point where the vision is getting blurred, and when they actually not seeing well, that is the time when they reach the doctor. Sometimes it will be considered very late. So it happens because the blood vessels have become little leaky, so they either leak blood or they can leak fluid. So what we call as edema, it goes into the layers of the center of the retina called macula. So when that happens, patients may see a very hazy, smoky vision.
Blurring of vision, they come. Okay.
Yeah, and if that stage crosses, probably they will have blood in the eye, and they may see blood as floaters. And if it is too dense, they even lose vision. Very rarely, retina also can get torn off and may necessitate a immediate.
It gets detached from the eyeball. Okay.
From the wall of the eye. it detaches, and it's a very thin structure. It's a thin,
Yes,
300
very
micron thin
like a
structure,
very fine film.
fine layer.
Okay.
So it's very when the advanced eye disease happens because of diabetes or even hypertension, etc., the retina get torn, and then it may necessitate a surgery at that point of time.
Okay, okay. And now that you have explained what happens, what is the remedy for that? What is the treatment?
Yeah,
And when did the patient should come to you?
yeah. So that's a very important question, ma'am. About
Hmm.
ABC, I say that A is about A1C to keep it below 7,
Yeah,
as
the blood sugar level to be below 7 or 6.5 to be precise. Okay.
yeah, keeping lipids
Hmm.
under good control. So D is where we come into picture, what we call as dilated annual
Hmm.
fundus evaluation,
And
where
a D for
so generally
diagnosis.
patients
Okay.
for diagnosis.
Hmm.
So generally patients, whenever they feel little blood, they feel it's the problem with the glasses. So they tend to go to optical shops and get their glasses changed. That is fine, but their examination should not end only with that.
They
Especially
should
those
come to the ophthalmologist to get
ophthalmologists.
the fundoscopy done.
Yeah,
Okay.
because when a patient comes to an ophthalmologist, they
Hmm.
do a detailed evaluation in the form of checking for number, checking for the eye pressure.
Hmm.
Sometimes it can be high also, what we call
Glaucoma,
as
like
glaucoma.
glaucoma. Yes. Hmm.
Yeah, they check for cataract, and also we do dilate, and the pupil gets dilated, and then we will have a detailed
Hmm.
fundus evaluation where we see the
Okay.
entire retina.
Okay.
So retina is the window to the the health of the person. Actually, we
Correct.
can see
Correct.
so many diseases. Sometimes we see the eye and make a diagnosis of the body also.
Yes.
So
Yes.
it's very important that to prevent
And
the
in fact,
disease.
one of the Takayasu syndrome in cardiology was diagnosed by an ophthalmologist because
Yeah,
he looked at the changes in the retinal artery. Very,
yeah.
very correct, very correct. So the eye is the window to the whole body and all the blood vessels. This is the only place where we can see. Now they have come with the damage. How do you stage it and how do you start the treatment?
Yeah. So we have several modalities. Initially, the fundus evaluation by using our set of lenses and
Hmm,
what we call as a slit lamp evaluation, we do look at
hmm,
the patient's eye
hmm,
in
hmm,
totality.
hmm,
And then we have certain modalities, like we can capture the damage
hmm.
through fundus photography, we can
Okay.
document it. And
Okay.
then we have certain modalities like OCT, which is like a
Hmm.
CT scan of the
Okay.
eye.
Okay.
We can
Huh.
compare
Hmm.
it to that. We can see the layers of the
Hmm.
retina. And then we also have modalities like fundus fluorescein
Okay.
angiography, where we give injection into the patient's
Hmm.
hand, the veins, and then we take pictures of the retina. Thereby, we can look at the state of the retinal blood vessels.
Okay.
Now we have something called a diless
Hmm.
angio also. We call it as OCTA,
Hmm.
OCT angiography, where
Hmm.
without giving an injection, we can
Hmm.
image the blood vessels in the retina, and that can
Hmm.
help us to decide whether it's an advanced
Hmm.
retinopathy, what we call
Hmm.
as proliferative diabetic retinopathy, or a
Hmm.
non-proliferative. It is little
Hmm.
mild to moderate stage, I would put it that way.
Okay, sir. Hmm.
Thereby, the decision to treat with laser or sometimes with injections will come into picture.
Hmm. What injection do you give?
So, in the eye with diabetes, or
Hmm.
it may be a disease like age-related macular degeneration,
Hmm.
or even retinal venous occlusion,
Hmm.
a particular entity can be
Hmm.
increased.
Okay.
So that damages the blood vessels in return, and then the blood vessels will become more leaky.
Okay.
So we give something like an antidote,
Hmm.
anti-VGF injections we give.
Hmm.
Sometimes this
To
is
prevent the
we've been giving
proliferation and the growth of the vessels. Okay.
the bad blood vessels.
Hmm.
And this is very popular since about 10 to 15 years, I would say. And we
Hmm.
also have certain steroid injections.
Hmm.
So thereby, we not only hold the, retard the progress of the disease, we
Okay.
also can recover some amount of the lost vision.
Vision also.
Yeah,
And it also avoids the surgery, the patient going to the surgery, which
to a
in
large
last
extent.
year, large
To a,
extent. What
to a
is the
large.
success rate of this injection?
There, it's pretty good, madam. Nearly
And the cost, what is the cost?
So if the patient comes in the initial stages,
Hmm.
the overall burden to the patient will be less, because number of injections he would require will be
Will be
less.
less, yes.
Will be less. Otherwise, the cost of these injections would range anywhere from 10,000 to more recent injections are there, which can go up to 50 to 60,000 also.
Okay.
More
No,
number
but
of
for the
injections.
vision, they were spending 10,000 is not 10 to 60,000 is not much, because
Yeah,
you are literally getting back your vision. That is a
getting
great
back
thing.
vision. And
So suppose this doesn't work, and if they come in the last stage of the retinal detachment or hemorrhage, then what do you do?
yeah, I think still, suppose we are not able to prevent and the disease progresses for whatever be the reason, patient should not be disheartened. I know there are enough treatment modalities now available which are very effective, and we do something called vitreoretinal surgery, where if the blood
Okay.
is there, we take the blood out of the eye, and if the retina is detached, we can put the retina back into its place,
You
and
stick it back.
reasonable
Okay.
reasonable amount of vision can be got back,
Retained. Okay.
retained.
Yeah, but
So
brought back. Okay.
patient should not be disheartened that vision actually got lost. There are, if they can still reach the eye doctor, a good
Specialist.
amount of effort can be done towards the recovery of the vision.
So the retina experts can do repair even at the last stages. So that's what you're telling.
That
So
is not
you said,
ideal.
yeah,
Prevention is always better.
better than
But
cure.
in
Excellent.
case
Very true,
patient
sir.
reaches that stage, we still
Yes.
have treatment modalities.
Yes, very true, sir. You said A, B, C, D. Now I would add E to that. That is, E stands for the eye. And if you want your eyesight to be good, go to the efficient ophthalmologist who can repair or prevent the disease progress. That's what we would like to conclude. So,
Yeah.
eye is a very, very special organ, and it is very important to see the world. So, better not lose the eyesight, and then get it repaired and prevent the disease from occurring. So thank you very much for giving so much of information so beautifully to our viewers, sir. Thank you very much.
Thank you, madam.